Stroke is a global health concern. According to the World Health Organization, it's the #2 cause of death worldwide and the #1 cause of disability. Stroke kills more people than AIDS, tuberculosis, and malaria combined, and 80% of all people who've had strokes live in low and middle income countries. The most common type of stroke is one in which an artery supplying blood flow to the brain becomes blocked. This is called an acute ischemic stroke. When blood flow stops, brain cells begin to die because of a lack of oxygen and nutrients. There are no drugs available for treating stroke in developing countries. My name is Michael Tomiansky. I'm a stroke researcher at the Toronto Western Hospital. In 2002, we discovered a drug that increases the brain's resistance to stroke. In animals, this drug can be given up to 3 hours after the onset of a stroke, and it reduces brain damage by as much as 80%. This can make the difference between a severely disabled or dead individual and one that can live independently and care for themselves. This drug has been demonstrated to be effective in human clinical trials. However, it has the undesirable side effect of causing a drop of blood pressure if given too quickly, and therefore it has to be infused under medical supervision using a pump. This limits its potential for utility in developing countries. For developing countries, a stroke drug needs to be inexpensive, safe, and simple to use. We've identified new drugs that meet these criteria and that could cost only a few dollars per patient, averting severe disability or death with a single injection. We propose to work with Dr. Peter Rivera, who heads the stroke program at the Philippine General Hospital in Manila and is a prominent member of the Stroke Society of the Philippines. One of their missions is to extend relief to the poor, distressed, and underprivileged affected by stroke. Because they have an infrastructure in place for education, there is an opportunity to work with Dr. Rivera for social innovation and to determine the best means to implement treatment in urban and rural environments. In conclusion, we have the opportunity to provide a solution to one of the biggest unmet needs in medicine: stroke in developing countries. We thank you for your consideration and look forward to working with Grand Challenges Canada.